Thank you for the invitation and the opportunity to share our project that we did. It's all about contact tracing technology to support health professionals in the effort to break the chain of spread of COVID-19. So it started in the middle of March when the initial measures to contain the spread of the virus was issued by the country, and then a team of individuals within our company highly motivated to support and to see what we can do in terms of technology, come up with an idea that we need to follow some of the world examples to innovate and to create a contact tracing technology that will assist the health workers in the process of tracing the potential exposures to COVID-19. We all know that the world is now facing completely different way of living. We have social distancing, travel restrictions, curfew hours, isolations, quarantine measures. So this is quite heavy hitting the overall normal life, but also the economy. There is a huge economic slowdown. There is complete industries that are brought to a halt. So there is a big pressure from the community that we need to go back to the normal way of living, but this cannot be done without protecting or issuing different kind of measures that will protect the overall society of new outbreak. And we have seen also the press release of the European Union, recommendations of the World Health Organization last week that societies going back to the normal will need to be prepared to do that. So the way to do that, one of the recommendations is to implement contact tracing technology that will help detect potential exposures if someone is detected as positive. And this is what exactly we are doing. And we wanted to contribute to the society, but not just to North Macedonia, but to anyone. We are donating this application to any national health authority that is interested to implement. And anyone that is interested to implement, we are open to donate, to discuss, to help them implement and put it into life for their country. The overall idea and the goal behind the project was to develop a tool that will be assisting the health professionals into detecting people that were potentially exposed. So we were talking to epidemiologists to understand what is the contact tracing that they're doing now without the use of technology. So basically, after someone is diagnosed positive, they're interviewing the person to identify whether the person has been in contact with someone. So he needs to list all the people that he was in contact with for the past 14 days. The distance that is considered is less than 2 meters of physical contact, and continuous exposure of up to 20 minutes. So it's considered that if you're just passing by a cashier desk in the market, it's not sufficient to get exposed. But if you are in contact on a meeting or you're discussing to someone, then you're potentially exposed. And then consider period that someone that has been exposed in the last 14 days can be considered as a potential threat to the surroundings and needs to go into isolation or for testing is the other parameter. But also all the privacy data concerns, because now dealing with all this personal data, who have been in contact with, where was this and who else was there, etc., is basically sharing my private data with the health professionals. But as I'm doing this during the interview of the non-technological tool to do that, I need to be able to share this data with the health professionals in a, I would say, protected environment that they can be used only by the health professionals. A lot of challenges during the design of the application was done. So basically we were considering whether to make it anonymous or not anonymous. So we made the both solutions. So the application can be deployed in completely anonymous way, meaning that when I'm installing my application and start using it, I don't need to identify myself by name or by phone on anywhere or anything that will connect to my personality. But also there is a way to implement the application as we did in North Macedonia is to use a phone registration. This is, we consider this to be more effective because by registering your phone, when I'm sharing my data to the health authorities, I'm giving a contact so someone can contact me. In the anonymous way of doing it, the only way they can communicate with me is through push notifications over phone. So there is no regular communication between the health professionals and the one being diagnosed as positive or the ones that are potentially exposed. So the only way to communicate with them would be through a push notifications. And you can consider yourself that you receive a push notification by health authorities saying you were potentially exposed to COVID-19 without sharing information that you were exposed to a specific person, and then you're instructed to go for testing or for isolation. We saw that this would not be very effective within the population, that they will consider this very seriously and act upon it. So that's why we implemented a not anonymous, but the application is available in both. And then consideration whether this should be a centralized or decentralized solution. So whether the data about the contact between the two devices using the application should be exchanged directly or through a server-based solution. So we choose to be decentralized, so we are not relying to any central solution on that. And it's completely private. So two devices will exchange data and no one will know this encounter unless I'm diagnosed positive. So we were considering whether to use GPS or Bluetooth technology. We know the concerns about people being tracked, about their location, where they move. So we immediately considered Bluetooth technology. First of all, because of not tracking people and their movement, but also because of the precision of this protocol, especially in the indoor space. So GPS can hardly enable tracking of location and distance indoors. So this could be also a big negative way. And also what technology and what features we should implement, but the underside to make it usable for the general public. So we have among the whole population people that are very skillful with mobile and smartphones, but we have huge part of the population that would not be very experienced using smartphone apps. So we consider that we need to build an app that will be zero interaction with the user. As soon as I install and activate, the app will work by itself. So it will not require any user engagement in order to track potential contacts. But also considered how to make it future-proof. So yes, this is a local application working for the domestic market for the North Macedonia implementation, specifically Stop Corona app. But what if someone is using this app and then starts traveling in a month from now? And then what if he's been in communication with another app, contact tracing app? How do we exchange those? How do we future-proof to be cross-border contact tracing? So if a potential exposure it's been done, then you can contact through the other health authorities also other potentially exposed contacts, so they can be interviewed or giving some measures to protect themselves through that exposure. As I said, minimal technology, minimal user activity using Bluetooth and using Bluetooth low energy protocol, which is considered that is not consuming battery almost at all. Our statistics says that for a 24-hour use of the application, your phone battery will be impacted less than 1%. So typically around 0.5% of your battery will be only drained, even if you use it 24 hours activated Bluetooth. Of course, complete data privacy, so the personal information of the exchange of contacts with any other device using this app will be only stored locally, will not be shared to anyone without explicit users' consent. So there is no share of data during normal use of the application. And of course, even in case I'm diagnosed positive and I'm asked to share my contact details with other potential exposed persons, then this is only shared to health authorities with a strict access to this data, with a strict protocol how to use this data. So how does it work? Basically, if I'm using the app, if I'm installing, using the installed app, then whenever I'm in the public transport, in the office, in the market, having a meeting, or at home, everyone that is using this application exchange temporary application IDs between themselves through the Bluetooth protocol, and this is stored in my local phone storage. And this stays there for the log of these contacts and encounters stays within the last 14 days. And it's not being shared to anyone, it's just kept to my phone. What is kept into my phone does not have any personal details about the other persons, but just their temporary application IDs. So I cannot identify who I have been in contact with, but I just have a temporary list codes. And in a case a person is being diagnosed as positive on the test for COVID-19, then that person is asked to share his contact details from his app to the health authorities. He is given a PIN. He is using this PIN in the process to share this data, and this package of these anonymized contacts are then sent to the server managed by the health authority. And then only the health authority have the access of this anonymized data. They can do epidemiologic analysis about the duration of the exposure, date of the exposure, not the exact time, but just the date, and the distance of exposure. And then to selected few of those contacts that they consider that were at higher risk, they can give specific instructions. They can send a push notification, they can send an SMS, they can call them and tell them that they need to go into isolation for a certain period, or they should report for testing, or any other active measure that they would like to present. As I said, the use of application is very simple. So you just need to register, in our case, your phone number, or you can work without the registration of phone number, depending on the deployment. And then as soon as I activate it with the code that is delivered through SMS, my application is already active. And it stays active all the time. It stays active in the background. The only, I would say, down part on the Apple devices is that the Apple does not work in the background to send, to advertise through low Bluetooth energy your temporary application ID. So the only way to do this and to make sure is that the application is in the foreground, or if some other device is nearby, like an Android device, sending and advertising their temporary ID, we detect this, and then we send a push notification to the user saying, you're in close contact with another user using the app, please activate your app so you can share your data to the other user so they can log your contact into their personal store. As you can see, the log is very anonymous. So it says an alias, this is a temporary application ID, the distance, and the duration of the contact. In case I'm diagnosed positive, then I'm asked by the health authorities to share my data. I share my data using a special send data button within the application. I need to confirm that I consent to share my data, and then I'm asked to enter the PIN that was previously sent to me by the health authorities. And then as soon as I share this data, this is given back to the backend application of the managed by the health authorities, so they can analyze date, duration, and distance of exposure. This backend application has specific tools for the health workers, how they can communicate with the patient, with the potential exposed persons, and send some instructions to them. Of course, there is a public website that is supporting informative public website with frequently asked questions, so everyone can use this web page to inform about the functionality of the app, or if they have any support questions to address, they can go through this. Both the mobile app, both the public website, it's localized to all the local languages plus English. So everyone can easily use and implement and use the application. What is the benefit? We have a rapid identification of potentially exposed persons due to the contact with an infected person. We have a tool for the health authorities so they can prevent the chain of spreading and break the chain if they immediately contact persons that were exposed to this person, so they can immediately set measures for them and test so they can rapidly react. And we as users of the application, basically we are giving our social contribution to the society so we can protect others if we are found positive quite fast. So basically it's a solidarity approach in using the app. And as many people are using, the more we can protect and potentially even save lives by early detection and early breaking the chain of spread. I once again emphasize it's full privacy protection, so there is no way that personal data can be misused in the system. And once again, to emphasize, we are donating this technology to anyone that is interested to use it.
Yeah, well, that's great. Well, that's been a great presentation. Thank you, Vashka. Look, I'm really happy that you addressed the privacy question. I think that issue, it's very important, everywhere, I guess, for everyone. So it's really useful to see that how you guys are doing that, and that it's anonymous, it's decentralized. It all looks very it looks great. But let me ask you, I think it wasn't mentioned, I believe that every success, of every digital solution, is impacted by the user's willingness to use it. So yes. How many downloads do you guys have? How many people are using it? What's the impact?
So in the first 4 or 5 days of use, there were 50,000 users of the app, which is approximately 2.5% of the overall population, or maybe say 3% of the population living in the country at the moment, because we have a lot of immigration. And it's considered that it's approximately between 2.5% to 3% within the first 4 or 5 days. There were a lot of debates and a lot of discussions about the data privacy, how the application is used. There were misinformation that government might misuse the application, but the source code is given to the government. The government is organizing expert review of the source code, so they can go and check the source code and the way the application is functioning. But then once again emphasizing there is no misuse of data. Even in case that users are just using the app to trace contacts and they never found positive, there is no way their data of their contacts with anyone is accessed by anyone else. This is stored only on their phone. And only in case they are found positive, they share these contacts to the authorities. But this is the same that happens when they're interviewed even without the use of technology. When an epidemiologist is interviewing a positive person of corona, they're asking them who you were in contact with, so they can contact them and then send them with some active measures, testing, isolation, quarantine, or whatever. So this replicates the same way it's functioning as an application to the ordinary way of work of the epidemiologist in case of detection of positive.
Yeah, I totally get it, but there is, I guess, a difference between trust in the medical system, in the healthcare system in general, and trust the government and technology. So that's why I guess that's still a kind of important issue. Look, may I just quickly ask you? So how do you? Contact tracing sounds very scary for someone who might not be aware of it, how it works and so on. How do you guys convince people to download your app? And is it actually fair for some older generations, because they might not use technology or use technology less, less frequently, let's say?
Yeah. So one of the key messages, starting from the latest comment, one of the messages that was sent in the promotion and during the presentation of the initial presentation, but also communication channels that are done through the peer campaign, is help the elders and people with less technological knowledge to activate the app. So basically, it's considered that someone else can, in 2 clicks, activate the app for their use. Concerning the concerns or whether the government is misusing the app, or people, shall they install or not install the app, of course there is concern, and there are group of people that will maybe never install this app. But concerns are valid, but they can be checked, and this concern can be addressed. The question is how willing we are to contribute to the society in the fight of COVID-19. Whether we can give 1% of our battery phone per day, trust the government that they are not tracing our private contacts, and contribute to the fight, because this is very important. It's not important today. It's going to be very important in 6 months from now, when we hopefully completely see that it's completely clean, then there is no pandemic and not even epidemic, but there are no positive cases anymore. But then all of a sudden someone travels somewhere and comes back from the travel, and then he's detected positive. How fast and how rapid we can intervene to lower the cluster of potentially exposed people and address this fast. This is the reason why we need to keep using this app, not for today when everyone is working from home, being isolated and not very in contact with others. But when we start living the normal life, starting traveling. Before this, I was traveling every week. Now I'm not in the travel for the last 6 weeks. This cannot keep up like this for a long time. And when everything comes up back to normal, we need to have the tools to protect. And this is our contribution by individually using this app, contributing to everyone's safety.
Right. And just like very, very quickly, how do you ensure that also kind of the elder generations, older people have access to technology? What's your take on that?
So the smartphone penetration in the country is extremely high. So we saw the statistics, talked to the telecoms, the smartphone penetration is 90+%. So basically there's certain population numbers that are not using a smartphone. Addressing the use of the technology by those owning a smartphone is that we address the public that they should help the elders and they should help their family members, the one that
Right.
do not understand technology, to activate the app. And this is the only way.
Right. Well, I just thought that it's important to mention. So thank you.
Of course.
Thank you very much for sharing your opinion. We are a bit ahead of time, so unfortunately we have to finish that. But thank you very much for joining us, and thank you for telling us your story and how you guys did it. That was really, really useful, and that was really interesting. So keep up the good work. Stay safe. Stay safe and healthy. Bye bye.
I congratulate you to the festival. Bye bye.